Radiation protection in interventional procedures and surgeries. Significant amount of X-ray is generated during various procedures. X-ray beam interacts with body tissues and then scatters in different direction. Scattered radiation, so generated in various procedures, is a significant source of radiation to the interventional doctors or surgeons who are in the surgical suite. Just because you can't smell it, see it, or feel it, doesn't mean it isn't serious. There is no amount of radiation that is good for your patients, medical staff, and yourself. Interventional cardiologists, radiologists, as well as surgeons performing procedures experience the highest amount of radiation exposure of any profession. It can affect human body in many other ways. Five major consequences of radiation. Consequences to body. Damage to back. DNA mutation. Damage to white blood cells. Musculoskeletal injuries are common in cath lab. 2 to 7 times higher musculoskeletal pain than in non-interventional operators. Affects reproductive system. Affects fertility in both male and female. Exposure to ionizing radiation reduces both sperm count and quality. Vascular aging. Malignant and benign thyroid tumors. Damage to thyroid gland. Effects of radiation to eyes. Cataract to eyes. Damage to eyes. Effects of radiation to hair and brain. Loss of hair and damage to head. Effects of radiation on hands. Protection against radiation. Less time spent near source, less radiation received. Greater distance from source, less radiation received. Behind shielding from source, less radiation received. Variable protection. Significant body protection. Excellent protection to thyroid gland. Protection for eyes. Disposable gloves for hand. Medical personnel in the surgical suite. Protect hair and brain. Protection at source, that is the patient, the shade. Path-breaking technology to create a safe zone free of scatter radiation, just like a shade during direct sunlight or an umbrella against rainfall. Creating a shade free from scatter radiation. How does it work? Scatter radiation. Rad block. Protection zone. The radial entry angiography shield provides protection during procedures which require access through radial or brachial arteries. During this procedure, the maximum scattered radiation emitting area is the patient's chest. The femoral entry angiography shield provides protection during procedures that require access through the patient's femoral artery. With a small fenestration and slit to the edge of the shield, it increases mobility around the shield. The multi-purpose shield provides protection to staff members working on the other side of the patient's table or by the patient's head during many types of interventional procedures. Radblock cuts most of the scatter radiation in the shade and protects the cardiologist and support personnel. Radblock shields are usable in both disposable and reusable formats. Scatter radiation is an occupational hazard, and the effort to shield the personnel from it is a basic need. Stay protected.